Health is a human right, but it is still not realized for far too many people across the globe. Providing primary healthcare is even one of the goals of the United Nations Sustainable Development Goals, and it should be given top priority. The India at 100 series aims to tackle India's sustainable development challenges through innovative solutions. Presented by DCM Shriram Foundation with knowledge partner, the Indian School of Development Management, the show will address the key issues that will directly impact the socio-economic condition in the primary healthcare system in our country. Let's take a closer look.
Primary health centers. PHCs are set up by the National Health Mission (NHM) to provide healthcare services in different areas. However, 60% of primary healthcare centers (PHCs) in India only have one doctor, while about 5% have none. Looking ahead, we face multiple challenges such as lack of skilled healthcare professionals, an increasing population to cater to, and unequal access to resources. But the greatest challenge of all is ensuring the basic health and well-being of people of all sections of society. The road for India achieving universal health coverage before 2047 is paved with strengthening its primary healthcare system, making it more people-centered, technology-driven, and reducing out-of-pocket expenditure. Let's understand from the experts why there is an urgent need to actively tackle this issue.
Hello everyone, welcome to another episode of India at 100. I am Ravi Sreedharan, co-founder of the Indian School of Development Management. Today on this episode of India at 100, we have another important topic at hand: primary healthcare in rural India. Joining us in today's discussion is Neeraj Jain. Neeraj is the Country Director India and Director South Asia at PATH. Neeraj, to get the discussion started, could you help our audience understand how serious is this problem?
It's extremely important, Ravi, because if you think about people in India or in actually most low and middle income countries, the primary healthcare structures are not necessarily delivering the way they could. At the moment in India, about 60 to 70% of our population still goes to a private healthcare provider rather than going to the public health system. Out of our pocket expenditure is about 70% of some of their income. So that's a huge issue. And that will only change once they start accessing the public health facilities. So, unless we strengthen our primary healthcare, we will not be able to service the population. And the policies are already in place. The health and wellness centers are getting rolled out across the country. The government is also putting lots of urban health and wellness centers in place. So I think if all of this comes together, and I'm very hopeful, I'm an optimist, so I'm very hopeful this will come together, then we will be able to service the entire population and look at population level wellness rather than looking at it only from a health perspective.
In the space of strengthening primary healthcare, surely we need to work on some very core systemic change. Could you talk us through what might be some systems change work that you're doing?
So health in India is a federal structure. I mean, the state, it's a state subject as we call it. And states in general have not taken charge as much as they could. We are seeing that change. States are starting to take charge, and not only states, districts are starting to take charge, and blocks are starting to take charge. So it's all sort of moving down to the ground. I think that's an important piece. If that happens, if right down to the panchayat level, if the Panchayati Raj institutions start believing that they need to deliver on health, we've got a huge change. We've got a wave of change that's happening.
Neeraj, you talked about involving the communities. Clearly, if you want to strengthen something that is as dispersed and remote as public health systems, surely the role of the community is very important. What is the sense you have about how the community can be involved, or the community is being involved in primary healthcare?
So in most low and middle income countries, we found that unless the community comes along and starts taking ownership, no development, large scale change happens. So the community has a large role to play. And I think the fact that you understand the health benefits or the challenges, and the community starts talking to each other, and the community actually nudges each other. I think that's going to be critical. Also, information sharing, the taboos, communities can play a very, very large part in this. We talk about tuberculosis, for example. It's not that if you sit next to somebody who has TB, you will get TB. There are certain things that you need to do to take care, but that's about it. So I think the community will play a very, very large part in our move towards universal health coverage. It is changing, and I'd say that if we are able to provide the information that's required, if we are able to provide that connect, things will move very fast.
Neeraj, if you were to think about India in 2047 or India at 100, what would your vision be for primary healthcare in this country?
First, most important one is going to be the focus on universal health coverage. How are we going to get there? We have a goal. We're working towards that. The entire sector is working towards that. How does everybody in India get services of a certain quality? So I think that's going to be absolutely important, and primary healthcare sits right at the center of that. The second big one for us is technology. So Ravi, India is a large country and we have a lot of people. It's a huge geography. We're all spread out. Technology is going to be absolutely critical. We cannot service our entire country without the use of technology. So our creativity on how we're going to use digital solutions, how we're going to use screening tools, how we're going to start thinking about population level wellness instead of just thinking about curative. The third that we can really see emerging as a big area is this whole intersection of climate, One Health, antimicrobial resistance is a big issue right now. How are we going to bring this together? So I think, again, we've got the right policies in place, the implementation is happening. We could really be the beacon for the low and middle income countries, and how that could happen, especially in a large population. And we're seeing a lot of that actually emerging already. I mean, telehealth, for example, during the last year or so, it's really ramped up in India. There are, about 100,000 telehealth centers which are operating already, primary health centers. So that's going to be absolutely critical. But these are the 3 or 4 big ones.
Thank you, Neeraj, for joining us today and a wonderful conversation. The video coming up next would unveil the incredible on-ground work that's actually making a difference.
To make primary health care accessible to all sections of society, the Department of Health and Family Welfare, the Government of Maharashtra and the Satara District Administration have partnered with PATH and other partners to strengthen existing primary health care facilities in the state and district and deploy innovations on the ground. The Smart PHC initiative aims to narrow the healthcare accessibility gap by enhancing services such as training healthcare staff, creating toolkits, facilitating teleconsultation, and introducing innovations. As part of this assistance, digital or AI-based innovations for screening have been deployed at Satara, including AlveoFit to monitor lung health, Maitri Niramai for privacy-oriented breast cancer screening, AI Stealth to observe heartbeat sounds on mobile devices, and REMOS for remote monitoring of critical vitals have been deployed in the district. These innovations help shorten the timeline for diagnosis and aid in early treatment.
शेंदूरजने आरोग्य केंद्रात मी तपासण्यासाठी आले होते शिबिरात. तर मला बीपीचा आणि शुगरचा त्रास आहे म्हणून सांगितलं, पण बीपीचा जास्त त्रास आहे, शुगरचा नाही आहे. तर मला या दवाखान्यातून दर महिन्याला मी शुगर बीपी चेक करते आणि गोळ्या मला मिळतात. घराच्याच बाजूला दवाखाना आहे, तिथून दूर काही जायला लागत नाही. इथंच मला सगळे गोळ्या औषध वगैरे मिळतात.
Integrated district labs are being set up at the block and district level, which will be the first point to detect and respond to a future disease outbreak. The focused approach is to upgrade primary healthcare centers, PHCs, in terms of better services, infrastructure, better competency of human resources, and achieving national quality assurance standards. Deployment of new diagnostic tools is leading to an early diagnosis of disease conditions and a lower mortality rate.
Time and time again, we hear that there is a lot of data, but there is a need for more evidence and data-based decision making. Like we heard in this episode, to get better at primary health care, work needs to be done at several levels of data. Data collection, data collation, data interpretation, and data analytics.